Welcome back to the Power of Two. Doctors call it a triple-demic. Cases of COVID, RSV, and flu are overwhelming U.S. emergency rooms. Molly Line reports.
It's not just here in Boston. Emergency rooms across the country are under serious strain. Janet Cook's recent visit to an emergency room at Massachusetts General Hospital in Boston was, in her words, horrible.
I was in excruciating pain, vomiting, unable to walk. I had hyperventilated.
Janet waited 8 hours for a bed, languishing in a hallway with other patients, and her case isn't unusual. Facing what's being dubbed the tridemic, a surge in COVID, along with cases of flu and RSV, a respiratory virus, hospitals across the nation are in crisis, ERs overwhelmed. According to the American College of Emergency Physicians, the situation has been years in the making.
It's just gotten to a breaking point where we're seeing literally people dying in waiting rooms across the country because there is nowhere for them to go outside of the waiting room.
The technical term for this medical purgatory is boarding. And a recent ACEP survey underscores the system overload.
We found that 97% of emergency physicians say that the boarding of their patients lasts for at least 24 hours. And about a third of those who did that survey said that it could be up to a week.
Dr. Terry says the situation is so dire, her organization sent a letter to the Biden administration urging federal intervention. In Boston, Molly Line, Fox News.
Pediatricians are also trying to save sick children. Researchers expect a severe flu season, so the record number of children with respiratory viruses could increase. So let's meet Dr. Wendy Hassan. She is a specialist in pediatric critical care medicine. Good morning. Thank you so much for joining us.
Thank you so much for having me.
So can you tell us what's causing this surge in children's hospitalizations?
I'm sorry, I'm having trouble hearing you. Can you say that one more time?
Sure. Can you tell us what is causing the surge in children actually being in the hospital instead of just sick?
Yes, there are multiple things that are happening at the same time. We're seeing a huge surge in RSV at the same time that we're seeing a surge in other common respiratory viruses, such as rhinovirus, enterovirus, COVID, and also just seasonal flu. And this is happening at the exact same time that we're dealing with a nationwide staffing shortage, not just in pediatric hospitals alone, but across the country. And so as a result, most children's hospitals across the nation are either at capacity or above capacity.
So why are more children getting sick in the first place?
So we are very familiar with RSV. RSV is a very familiar foe to us in pediatrics. It's a very common respiratory illness that affects children under a year of age. And so if they get sick in the first place because the virus causes a cold deep inside of their lungs that causes mucus production and therefore trouble oxygenating and causes a severe cough, which can also lead to dehydration. What's interesting about this virus is that usually it affects children less than a year of age, but more commonly this season, we're seeing that it's causing older children, ages 2, 3, 4, and even 5, to be hospitalized.
So what can parents and caregivers do to prevent illness in the first place?
Washing hands, washing hands, washing hands is the most important. I have a 4-year-old and a 7-month-old. The first thing I make my 4-year-old do when he walks in the room is wash his hands. Other things they can do is feel empowered to say no to visitors, particularly parents of young babies. Feel empowered to say, no, this is not the time to come visit my baby. And also making sure that children are up to date with all of their routine immunizations and children over 6 months of age with their flu vaccine to prevent them from needing to go into the hospital for other reasons as well.
Those boundaries can certainly be life-saving. We will have a link to more information on fox2now.com. Dr. Hassan, thank you so much for joining us.